Welcome to the MS-Perspektive podcast, Perspective with a K as I'm German. I'm Nele von Horsten, MS patient, patient advocate and author. I'm bringing you interviews, inspiration and information about living with multiple sclerosis and show you ways how you can positively influence the disease and make the best out of your diagnosis. On ms-perspektive.com you will find the show notes, 11 free tips as a PDF and lots of other information. And now the show begins. Thanks for tuning in again and welcome to episode number 81, Navigating Treatment and Support for MS, NMOSD and MOGAD in Montenegro with Dr. Sanja V. Gluscevic. Hello Sanja, it's such a pleasure to have you on the show. Thanks for coming here.
Thank you, Nelly. Thank you, first of all, so much for your kind invitation to participate in your esteemed podcast today.
Yes, and thank you for being here. But before we actually start with the interview, it would be lovely if you could introduce yourself to the audience so they know who is with me on the podcast today.
Thank you, Nell. So I'm a neurologist specializing in MS and other inflammatory disorders of the central nervous system and epilepsy. I come from Podgorica, which is the capital of Montenegro, which is a very small and picturesque country in the Balkans, with approximately 620,000 inhabitants. I've completed my residency and fellowship training in epilepsy and clinical neurophysiology at the University of Belgrade. I had the privilege of learning from eminent figures in the Balkans in the realms of MS and epilepsy. Currently, I'm engaged in pursuit of my master's degree in multiple sclerosis at the European Charcot Foundation, where I also serve as vice chair of EC Young Investigator and Fellow Community. I also do my PhD thesis in epilepsy at the University of Montenegro. I'm as well DSF, the Sumeiro Foundation Ambassador, where I serve as the voice of NMOSD and MOGAD. And I've also recently been appointed as the first Montenegrin Ambassador of Neurology and Brain Health by European Academy of Neurology. Beyond my personal endeavors, I take immense pride in fulfilling roles of mother and spouse and a devoted owner of a Russian wolfhound. She's a bar baby and we call her Coco. My passion for exploring diverse cultures through travel is unwavering, and I find solace and inspiration in tranquil nature walks, accompanied by classical or rock music, depending on my mood, while delving into depths of literature, exploring the intricacies of human behavior from a psychological and a neuroscientific perspective.
Wow, you are a very busy person. That's very, very, great. And how do you choose to become a neurologist and to specialize on these diseases like MS and NMOSD and MOGAD and epilepsy?
The driving force behind my career choice stems actually from a really deeply personal place. Becoming a doctor has been a lifelong dream for me, and it tracks back to a really important moment that is captured actually on an old cassette tape for my 5th birthday. So in that recording, my mother's voice tenderly asked me, "Okay, what do you want to be when you grow up?" And without any hesitation, young me confidently declares, "Oh, I want to be a doctor." And what makes this aspiration all more remarkable is that the fact that no one in my family has ever pursued a medical career. Rather, they all excelled in law, sociology, psychology, and similar domains. But from the earliest moments of my recollection, I harbored a profound desire of helping the ailing, the vulnerable, and even our small furry animal companions. And this fervor accompanied me throughout my primary and secondary education, where I gravitated towards the sciences and excelled in biology competitions, where I clinched first place multiple times and even earned the national accolades. But the allure of neurology, it truly captured my imagination upon completing anatomy classes during my academy journey. The intricate dance of these remarkable gray matter cells and their communication network and astonishing functionalities really left me spellbound. It was really from that moment on that my fascination toward neurology really burgeoned and eventually leading me to where I stand today, being a really dedicated and empathetic neurologist. And I'm really driven by a passion to make a difference in the life of the others. For me personally, there is no better field in medicine but neurology.
Yes, absolutely, and especially with all these lovely MS patients. No, but actually, we for sure we need empathetic neurologists, because it's so important. It's not easy to get the diagnosis, and it's really nice if you have somebody who feels you and who gives you a warm atmosphere and tries to show you that life is not ending here, but we can go through this together. So actually, what is the prevalence of MS, NMOSD and MOGAD in Montenegro, and how many people receive a new diagnosis each year?
Mm-hmm. Unfortunately, in Montenegro, although we are small, but we lack national MS registry. So we rely instead on data from the Institute of Public Health and registry, hospital-based registry, which is based in our main referral hospital. That is the hospital actually I work in, which is called the Clinical Center of Montenegro. It is a sole tertiary center and referral facility for MS patients nationwide. And it is with our clinic that we make final decision not only on the diagnosis but also on disease-modifying treatments for each and every patient with MS. So using data from the Institute of Public Health, we have a total of 877 MS patients. But in our own internal registry, we have 107 patients less. So this disparity is probably attributed to immobile patients who are receiving in-home care, leading their relatives to seek consultation on their behalf, as well as individuals either not availing themselves of DMT treatment, or unfortunately, we also have those patients who decline disease-modifying treatment. So if we're having these numbers in our mind, the prevalence of MS in Montenegro stands at around 142 per 100,000 individuals. Of course, as in other countries in the world, we evident the rise in prevalence, which is fueled primarily, of course, by enhanced diagnostic practices and increased longevity among MS patients. While the gender has remained steady for over 2 decades, with the female to male ratio of 2:1, the majority of diagnosis occurs, as we expect, in patients in their 20s or early 30s. But notably, a growing trend of older individuals receiving diagnosis in their 50s or 60s has emerged, which is also a globally recognized phenomena. Annually, we have between 40 and 70 new MS patients diagnosed. So that results in an incidence ranging from 6 to 11 per 100,000 individuals. When it comes to NMOSD and MOGAD, NMOSD presents with a prevalence of 1.2 per 100,000 patients, and an annual incidence is actually 1 per entire country, so 1 per 600,000 patients. Conversely, MOGAD carries a prevalence rate which is much, much lower, of 0.3 per 100,000. But presently, there is an ongoing study focusing on NMOSD and MOGAD patients in Montenegro. So I hope that we will have some more precise data on incidence and prevalence in the first half of upcoming year.
Okay, thank you. And how aware is the general population of multiple sclerosis, NMOSD and MOGAD in Montenegro?
Well, the level of awareness surrounding MS exhibits a significant variance. So despite escalated efforts in MS awareness campaigns in recent years, the extent of awareness remains inadequate compared to more prevalent health conditions like diabetes, hypertension, cancer. Of course, if we talk about capital and urban localities, there exists a relatively higher level of awareness due to, of course, dissemination information through social media, television, or in the healthcare services. Of course, in rural and undeveloped regions, awareness levels are notably low, especially due to constrained healthcare resources and scant awareness initiatives. So this disparity poses challenges in accessing accurately and scientifically validated information. So enhancing collaboration among healthcare professionals on one side, advocacy group, and communication educational programs are imperative if we want to address this knowledge gap. among the general populace presently. Neurologists are only called upon MS Association of Montenegro, and it's affiliated solely on the World MS Day. And unfortunately, during that day, neurologists talk only to the patients, their families, and caregivers about the MS symptoms, the diagnosis, the management, rather than reaching out to broader communities. And neurologists as well are to blame because we have a sparse television appearance as well. So I personally perceive this approach as woefully inadequate. And on one side, we have physicians who play a pivotal role, not only in the treatment, but also in fostering education. And as we all know, knowledge undeniably empowers individuals. So role of physician or neurologist is not just to cure patients, but also to advocate for brain health and for preventive strategies. So I personally witnessed all of these insufficiencies. So I actually proactively initiated the establishment of my own nonprofit organization, which is called Montenegrin Association for Brain Disease Hope, to help bridge these existing gaps. This organization of mine actually will serve as a conduit between healthcare professionals and patients, translating the complex scientific jargon into layperson terms. Because by fostering communication and understanding, we will try to endeavor and untangle misconceptions and dispel myths. And hopefully, we will enhance the satisfaction not only among our patients, but also among healthcare providers. So I strongly believe that together, if we are unified in our efforts, we are stronger, we are sharing knowledge, and as we know, knowledge paves the path to enlightenment. But this is the part when we talk about MS. When we talk about NMOSD and MOGAD, there is actually a concerning lack of general awareness because unfortunately, these conditions receive limited discourse even among neurology circles. So for many individuals, the disorder is largely unknown. So through my role as a Sumeira Foundation ambassador, I've really successfully connected with NMOSD MOGAD patients in MS, directing them to really comprehensive website housing invaluable and, what is most important, scientifically accurate information alongside the numerous testimonials and which are all translated into our native language. So this outreach has proven very transformative as a substantial number of patients and their families face challenges in assessing reliable information. As a substantial proportion of my patients have language barriers because they lack knowledge of any other language except for the native. So this outreach was really informative and transformative, and these patients have really gained a lot of new information regarding their disorder. So with the establishment of my nonprofit organization, I'm really optimistic about reaching a wider audience through TSF website, recognizing that sharing knowledge is a really cornerstone of awareness and that true power lies in fostering and understanding through education.
Absolutely. I mean, that's why I'm doing that podcast, in order to hopefully empower patients. I mean, of course, more focusing on MS, but I'm trying to give some place to NMOSD and MOGAD nowadays, because it's so important.
You're doing an amazing job, really amazing job. And I'm sure that you really fueled your positive energy in the community, and they're really, really lucky to have you. Really
Thank you. Thank you. So what are some of the challenges faced by MS, NMOSD and MOGAD patients in Montenegro regarding access to healthcare and support services?
One of the main challenges of our patients is medication procurement, because it is cumbersome for patients from distant cities to come and to attend treatment monitoring in the capital. But they are aware of the importance of adjustment of treatment, so makes it a little bit easier to cope. Patients typically undergo routine checkups locally and visit our center only for the necessary consultation and more comprehensive care. But exception is made for patients that are from the capital, since our facility serve as a sole provider for those patients, irrespective of the fact that it is a tertiary level status hospital. When it comes to NMOSD and the MOGAD, our patients are in not that good situation as patients with MS. Especially when it comes to treatment, we only have satralizumab, and other FDA and EMA approved treatments are not currently available. The treatment for MOGAD patients is actually usage of off-label medication, azathioprine, mycophenolate, and rituximab. But what I see as a healthcare provider being most challenging for these patients is the absence of cell-based assays for patients with MOGAD. For the accurate diagnosis. So the other process of obtaining medications mirrors that one of the MS patients, with regular checkups being conducted at our hospital. So what I also found during my outpatient consultation is that patients frequently express challenges in assessing physical therapists, psychologists, ophthalmologists, due to their demanding schedules, highlighting really an unmet need in this area. So thanks again to Montenegro and MS Association, the government has provided specialized rehab sessions for a duration of 3 weeks annually for each patient at the government expense. And this is a service that our patients find immensely beneficial.
Yeah, I can totally understand that. It's so important to take care of symptomatic treatment and to rehabilitation. So which cultural stigmas or misconceptions existing surrounding MS, NMOSD and MOGAD in Montenegro, and how do they affect the treatment and management of MS in your country?
Well, a global phenomenon, all neurological disorders are unfortunately met with stigma and misconceptions, so Montenegro is not an exception at all. We have a notable lack of understanding about MS, and this really fosters various misbeliefs. Common misconceptions persist, such as the belief that MS is contagious, unfortunately, and that can be transmitted via blood, or that MS will definitely lead to severe disability. So this conception is, as one can expect, is prominent among older individuals. When I say older, I mean 65 plus, with a longer disease duration, while younger patients hopefully tend to hold more informed perspectives. As a female healthcare provider, I'm really particularly passionate about the issues concerning pregnancy and sexual health among women with MS. But regrettably, some women still perceive MS as a hindrance to pregnancy, which results in diminished commitments to relationship and marriage. Also, a big issue in Montenegro is that upon MS diagnosis, people with MS they face a huge job insecurity and most often dismissal. We all also encounter rejection and are sometimes being allocated to different work environments, and that evokes, of course, feeling of inadequacy and high frustration. And of course, as one can expect, this will drive to social isolation, income loss, disrupt family dynamics, and this really has a huge impact on overall quality of life. Cultural beliefs, on the other hand, may lead some proportion of individuals to prioritize alternative therapies over conventional medical treatments, and in certain cases, individuals also combine alternative with traditional treatments without disclosing this information to a healthcare provider, so potentially leading unforeseen interactions or exacerbation of their disorder. I myself, unfortunately, had the chance to see 3 patients who really had severe worsening of their disease because they actually chose not to disclose what other treatments they use. So there exists, unfortunately, a misconception as well about the efficacy of available MS treatments, because individuals often engage in discussions based on their personal anecdotes, and they inaccurately and very, let's say, verbally aggressively present them as a scientific truth. So this could result, and this unfortunately do result, in a poor adherence to medically recommended therapies. When it comes to NMOSD and the MOGAD, things are quite different because these are still disorders unrecognized among patients. So given their severe clinical presentation, particularly very severe optic neuritis and or transverse myelitis, patients typically adhere diligently to prescribed medication and actively seek further insights from their healthcare providers. However, this proactive approach does not preclude individuals to explore online resources such as blogs and the internet to access information about their disorders, which may inadvertently expose them to inaccuracies. I mean, I can understand that because navigating through the vast digital landscape and discerning accurate information amidst plethora of available data is really a considerable challenge in a modern era, even for doctors, not only for patients who are facing for the first time really severe disorders.
Yes. That has become a very huge problem, and it's not so easy to fight back on the misinformation that happens.
Absolutely.
Yeah, so let's talk a little bit about access to treatment. What types of treatments, therapies, or interventions are more commonly recommended or accessible in Montenegro?
Our patients with MS are really lucky because healthcare insurance is comprehensive, so treatments are covered by the government, and the patients have access to almost all existing MS treatments. So we typically treat relapse with corticosteroid treatments or with the plasma exchanges. DMTs encompass injectables, oral medication, monoclonal antibodies, and they are administered according to healthcare regulations in Montenegro. I would like to see this changed to really actually implement the flipping of the pyramid, but so far this is not still achievable. But luckily, we have all the drugs possible. So first-line treatments include interferons, glatiramer acetate, teriflunomide, and dimethyl fumarate. Second-line treatments comprise of fingolimod, siponimod, cladribine, natalizumab, and alemtuzumab. This is per patient basis. So one can see that, for example, alemtuzumab and cladribine are for some patients second-line treatments, for others are third-line treatments. But third-line treatments are definitely ocrelizumab, ofatumumab, and in some patients, cladribine as well. Unfortunately, autologous hematopoietic stem cell transplantation is not available in my country. But when it comes to symptomatic treatment, alongside with the MS disease-modifying treatment, rehab plays a crucial role in maintaining health in MS patients. So while most individuals attend this one rehab a year, let's say professional rehab, a minority will engage in the prescribed exercises throughout the year, unfortunately. Of course, we have an aging population of MS patients. Many of these patients require assistance in physical training. But due to limited accessibility and busy schedules of our physical therapists, they may not engage in sufficient physical activity as we would like to. So when it comes to specialized physical treatment, we only have this one, unfortunately, one per year, but we are lacking utilization of robotics and novel neurorehabilitation modalities. Just 2 days ago, I had really exciting news from my colleague. He's the president of Montenegro Neurological Association, who told me that all of my colleagues signed a petition so we can implement robotics in the rehabilitation of our patients with MS. So I firmly believe that this approach should be further promoted, and it is essential for the government to support this initiative because it can really significantly enhance the quality of life of all our patients.
Cool. Yes. Sounds really good. And we have issues here in Germany as well with the AHSCT, so it's only offered to very small group of patients. So it's not it's not available to everybody who might have advantage of that.
I hope that will change. We have some really perfect MSologists who are pushing towards to it, because if we wait too long, nothing will change. That is also the concept of flipping the pyramid. Start aggressive so you can also follow the patient more not just I'm not one of those neurologists who like stepwise approach, because MS is not the disease you want to cuddle with.
Yeah, absolutely. Totally agree. So are there any specific laws or regulations in Montenegro that protect the rights and promote the well-being of individuals living with MS?
Yes, there are some, but from my point of view, insufficient. Thanks to our Montenegrin MS Association, patients that do receive reduced fares for all forms of public transportation and are exempt from paying the VOTs during the importation of vehicles for disabled individuals. What we are, as neurologists, really thankful to Montenegrin MS Association is the chance that all our patients with MS can access specialized inpatient hospitalization service for 21 days annually for each and every patient every year. Also, some municipalities provide discounts on utilities such as water or electricity bills. And apart from rehab for our patients with NMOSD and MOGAD, but only who are featuring transverse myelitis. Unfortunately, for this category of patients, no additional or special laws or regulation are applicable so far.
Yeah, let's hope this will change in the future. So how do patients in Montenegro cope with the challenges of living with the different conditions?
Well, patient associations related to MS are, of course, instrumental in providing essential social support and legal guidances as well. These associations are typically led by individuals with personal experience of the condition or volunteers, although neurologists are often willing to contribute to these efforts. Recently, psychologists have joined us and are being invited to participate in numerous initiatives. Throughout organizing these activities, of course, these associations foster a sense of community and provide invaluable emotional support, which I find highly influential and highly beneficial for our patients. I strongly believe that more can and should be undertaken in this realm, and I'm optimistic that with the non-government organization, I, with all my other colleagues, could really contribute significantly because enhancing academic support, implementing preventive strategies, increasing patient involvement in research, and facilitating open discussions, especially with family engaged, and expanding emotional support programs are among those aspects that should be addressed and must be addressed in our patients. There are no specific patient association regarding NMOSD and MOGAD, so the opportunity for our patient to access the TSF website is vital for education of these individuals and for fostering a sense of belonging to a really huge global community and support network. What I really find particularly significant are the testimonials. Unfortunately, patients in Montenegro are highly hesitant to share their stories. And sometimes if they do want to share their stories, they will always request to keep their identities anonymous, being by hiding their face or altering their voice. So this stands in a stark contrast to the culture in many European countries I've visited, and in the United States. So it really saddens me to witness this sad reality, and I really can only imagine the inner struggles these individuals endures. So, like I told you, Nell, your podcast is really incredible, and the things you do and going way and beyond for your patient, for your community, and all the patients is really inspiring. And I'm sure that your community is undoubtedly very grateful to you.
Yeah, let's hope that I can make a difference, and you are doing as well, and all your colleagues from the different countries. I mean, I have some of your friends who are engaged in the Mara Foundation as well on the podcast, and it's really great what you are all doing. And I think that new generation of neurologists will really impact how life for people with MS, NMOSD, MOGAD will be like. And yes,
because it's been a shift in paradigm. We are just not the doctors, not the patients. We have to collaborate together, because I can guide you as a physician, but I have to have feedback if that is okay. If it's not okay, then we can discuss and find the other alternatives.
Absolutely. I mean, you know, Chalf Teamson, he is my neurologist since so many years, and he has that nice picture of he is a coach and I'm the player on the field, and we are in this together.
Yeah,
and I have to make the decisions, but he is the one who has the knowledge. And let's talk about it. Let's do shared decision making, and let's do be adherent with the therapy and the chosen therapy, and then we can go through it together. Yes, and then we can have.
Hope that all neurologists in the world will finally accept this concept, because it is the only one that works and the best for
Absolutely. So what roles do social support networks and community resources play in supporting MS, NMOSD and MOGAD patients in Montenegro?
Well, of course, they play a pivotal role in enhancing public awareness and understanding. These platforms, they will offer opportunities for individuals to share their experience, but still very, very, very modest. But they can receive advice, they can garner encouragement, they can reduce what is very, very important, the feelings of isolation. So by leveraging these resources and networks, MS patients as well as NMOSD and MOGAD patients can better manage their condition and uphold a higher quality of life. So greater involvement of neurologists, of course, is crucial, and I hope this will unfold in the near future. So personal experiences can occasionally lead to misconceptions and frustrations, and efforts to heighten public awareness about MS especially aims to combat this stigma and dispel misconceptions. So educating not only the patients, the families and the caregivers, but also the public on the nature and the impact of MS cultivates a more supportive environment for those affected by this condition. So the global trend of diminishing empathy, of course, for me is very concerning, and it is imperative to actively promote empathy and support. So genuine support for patients with NMOSD and MOGAD currently in Montenegro stems from the International TSF Foundation, which offers an abundant resources and, of course, unconditional support.
Yes, so let's talk a little bit about the Somora Foundation. How did you become an ambassador of the Somora Foundation, and what has changed as a result?
Oh, for me, it is really a privilege to share an experience as being one of the TSF ambassadors. I became an ambassador of the Somera through introduction of my really esteemed friend and brilliant colleague, Sara Samazade, and I had the pleasure of meeting Somera personally. She's the executive director of the Somera Foundation and the patient of seronegative NMOSD. She's really had a remarkable journey and unwavering commitment to raising global awareness about NMOSD and MOGAD and other rare neuroimmune conditions. She did really an amazing and inspiring job, and she also serves as a wellspring of motivation for me personally and for all those lives she has impacted undoubtedly. So being a part of Somera Foundation has underscored the belief that with increasing passion, the courage and determination to break down the barriers, one can make a profound and positive impact on the lives of those who are in need. So despite the scarcity of patients with NMOSD and MOGAD in Montenegro, individuals with rare or let's say orphan disease often find themselves in a realm of uncertainty, fear and doubt. So the opportunity presented by TSF has enabled me to channel my efforts towards bringing about positive change in the lives of these patients. Numerous ideas are currently taking shape in my mind. So with continued support of TSF, I'm optimistic that in the very near future, all NMOSD and MOGAD patients in Montenegro will immensely benefit from our endeavors.
Sounds really great, yes. And it's really fantastic that there is such an initiative. So are you involved in any research related to NMOSD and MOGAD, and what is the main goal?
Last year, actually, the Somera Foundation received 47 applications from 18 countries. So following, of course, a comprehensive review process, my project, which was titled NMOSD and MOGAD in Montenegro, Clinical Aspects, Pain and Community Impact, was one of the 7 projects chosen to receive a TSF Spark grant. So I'm really, truly honored to be a grant recipient, and the ongoing support from the CSF through these grants not only complements but also advances the Foundation's evolving mission, and that is to focus and extend aid and resources to patient communities beyond the United States. This study represents actually a pioneering effort in my country and promises to offer invaluable insights into the clinical aspects of this really orphan disease. In my country, we only have 11 patients. By addressing current knowledge gaps and alleviating invisible symptoms, the research will aim to enhance the quality of life, to foster community engagement, and shed light on the challenges faced by individuals with these disorders in my country. And I'm really confident that this opportunity given by the TSF will greatly be evaluated by those affected with these conditions, providing them with a reliable resource and, like I said, a really supportive global community.
For sure it will. Okay, let's come to the quickfire Q&A session as we are getting a bit towards the end. Complete the sentence. For me, multiple sclerosis, NMOSD and MOGAD are?
Well, when it comes to MS, MS plays a dual role in my life. Professionally, it stands as the most profound teacher, a relentless source of daily learning and insights that fuels an unending quest for enhanced treatment options and fervent dedication to advocacy. Looking ahead, I firmly believe that our conversation will evolve from treatment strategies only to preventive measures. And this optimistic outlook drives my commitment to advancing our comprehension and management of MS with the ultimate aim of course, positively impacting the lives of those grappling with this condition. Personally, as a spouse of someone who is living with MS for the last 15 years of his life, MS serves as a poignant reminder that of the transformative power of compassion, love, and encouragement amidst adversity. When it comes to NMOSD and MOGAD, their enigmatic nature sparks my fascination, introducing numerous layers to explore and navigate along the way, from a quite pessimistic prognosis just over a decade ago to a disorder that now can be more efficiently managed. I hope that this optimistic shift will brighten the future and serve as a driving force for ongoing dedication to research and advocacy in this field.
Yes. So what development would you like to see in the field of multiple sclerosis, NMOSD and MOGAD in the next 5 years?
The inadequacy of one-size-fits-all approach to research has become increasingly apparent in the recent years. So I belong to those neurologists who believe that discussing the prevention of MS is really a possibility, but unfortunately I think it will remain unattainable in the near future, in the probably next 5 to 10 years. But as a proponent of personalized medicine, I envision the future where we not only discuss the customization of MS treatment, but also will contemplate the individualized care of patients, not only with MS, but also with NMOSD and MOGAD. So I really personally advocate for implementation of predictive models tailored to each patient, unique characteristics like genetics, biomarker profile, disease severity, presence of environmental risk factors. So the shift towards personal care will definitely enhance disease management, addressing both visible and, of course, hidden symptoms, which are often more bothersome than these visible ones. While this approach has gained traction in several countries, I strongly believe that integration of patients' feedback into clinical trials will become more pronounced in the coming years, because the patients' perspectives and experience, which have been long unfairly overlooked, are imperative for shaping research priorities and outcomes that ultimately will enhance the quality of life of those affected by these conditions. So, unfortunately, not everything is set in the world as it should be. So there are regions where effective and established treatments remain still inaccessible. So ensuring equal and accessible healthcare must be a top priority.
Yes, and let's hope this will change for the better soon.
Yes.
In all these underserved regions. Yes, that would be so great. Okay, so finally, what message of hope or encouragement would you like to share with individuals living with MS, NMOSD and MOGAD in Montenegro?
Well, never surrender. That is something I always tell to my patients. Never surrender. You have to hold on to hope, because it's very important to know that you are not navigating your journey alone. The resilience and the personal stories, they really do serve as a cornerstone of our advancements, inspiring us to intensify our research efforts. A vast global of network of researchers, of clinicians, of healthcare professionals really stand behind you. The past decade has witnessed remarkable breakthroughs that have really transformed not only treatment approach but also personalized approach, heralding a brighter future. So our collective aspiration is that one day discussion will center not only, like I said, from finding a better cure, but also preventing this condition altogether. So we should forge ahead and with unwavering determination and shared purpose.
Yeah, thank you for that lovely statement. So how and where can interested people follow your research activities, Sanja?
Interested people can follow my research activities through publications on my academic platform, ResearchGate, or on my professional social media, LinkedIn.
Yes, and of course I will link it in the show notes, so you, dear listener, can just click in the show notes and find Sanja there. Sanja, it was a pleasure to talk to you. Thank you very much for everything you are doing for your patients, for all your efforts, for all your really, love and warmth bringing into patient care, because that is really so important. It's not just, we are not computers. We are people who are afraid of the future sometimes, who are afraid of changes, who are hopeful, and sometimes the hopes are get crashed at one point, or at least for a while. And so it's so important to have somebody empathic at your side. And I think you are really doing a great job. So thank you very, very much. And I hope to see you in the future at one of the ACTRIMS, not this time in Copenhagen, but maybe next time in Barcelona. That would be very lovely.
Nele, first of all, thank you once again. It's really an honor and privilege to be on your podcast, and thank you very much for these kind words. Maybe it's because the way I was growing up, and the way I see and perceive the world around myself. Being a doctor is really nice, and you have a huge responsibility. You're responsible for other person's life. You take decisions that are really hard, and but if you do it like a robot, you're not doing anything. We are living in a world that probably robots will actually be our best competition in 20, 30, 50 years. But compassion and empathy is something that everybody needs, especially when it comes to neurology. I mean, everybody should come from their point of view to see, for example, if you go to dentist and he tells you that you have a really bad tooth, you will be really, really sad on that day, not discussing the chronic disorders. So having empathy and first being a human and then a doctor is really important. And the concept of sharing this and decision making is really important, because we have the knowledge we gained from the books, from the patient's experiences, and you are actually living in your own body with all these sensations we do not know anything about if we are not patients. So being empathetic, understanding patients, and just not overlooking those hidden symptoms is extremely, extremely important. Without empathy, we are just like any other robots. Okay, here are the drugs, that's it, bye-bye. So empathy, I think, is really, really important, and constant improvement and absolutely positive uplifting of the patients.
Yeah. So thank you for all that, Sanja.
Thank you very much, Nele.
Bye-bye.
Really an honor to meet you in person. So hopefully in Barcelona next time.
Yes, and Barcelona is lovely. So
absolutely.
Thanks. Bye-bye.
Bye-bye. Bye-bye.
I hope you learned something new and got an idea of how it is to get treated in Montenegro, and maybe about what is different to your country, to your treatment options. By the way, next time I will be talking with Leda Bresnov from Denmark about how it is to live with neuromyelitis optica there and her experiences. So it will be interesting. Please tune in again. Stay as healthy and positive as possible. And yeah, if you know somebody who might be interested in the podcast, please to recommend it to that person or rate the podcast on the channel where you are listening to it. And see you next time. Bye. Thank you for listening today. I hope you found it helpful. You may also be interested in the previously published episodes and posts, which you can find at ms-perspektive.com/podcast. Perspective with a K. You can also get a free PDF with 11 tips for your positive impact on MS at ms-perspektive.com/newsletter. If you'd like to get in touch, you can reach me at nele@ms-perspektive.com or on social media. See you next time.